Something I've been thinking a lot about as a therapist, especially in this day and age where we use words like trigger or trauma all the time. And on one hand, there's something good there, right? Like, okay, we're getting more psychological language. It's becoming more common. But what's so interesting is that those that language often is being used to shut down process, to shut down looking at the uncomfortable. And we're looking for places not to grow, but actually just to make us feel better, which is different. And it's not that healing or growing won't ultimately, hopefully, make us feel better and more healthy, but it's usually not instant. And so part of this is learning, like, I often have patients come to me where I'm not their first therapist. I'm their second or third therapist. And it's because, well, maybe their first or second therapist was able to give them tools, breathing exercises, worksheets, some psychological content, which is good. We need that. We really do. There wasn't, they didn't find an ability to go to the next level down, to really look at the things that are painful in a way they can still tolerate. So that really is something that I feel like is the art of therapy, is how do we provide enough empathy and validity and support while also helping each person be exposed to the pain that they need to face at the same time at a rate that they can tolerate. If you give them too much, they shut down or they are defensive. If you give them too little, they never change. And that is the art of therapy, and I think it's an art that in some ways gets lost, even with therapists. There's a lot of therapists. I have patients that say, like, are you just going to be a therapist that just, gives me empathy and validates my feelings? Which, again, is an important part of our work. Or are you going to really help me heal? And, like, I think that's it. Like, how do we help someone? How do we empathically, warmly, but firmly challenge people to look at the things they don't want to look at? Because they don't want to look at it. That's why they're coming to you. So that's something I just think about a lot.